So good morning, everyone, and thank you so much for joining this session today. My name is Camilla, and I'm consultant midwife at East Midlands Ambulance Service and one of the lead midwives at London Ambulance Service. And I'm here with some incredible colleagues today who are going to introduce themselves as we go through the webinar. So thank you so much for taking time out of your busy workday to attend today, and we hope that it's going to be useful. Just a few little ground rules to begin with, if that's okay. So just if you can keep yourselves on mute throughout the webinar. If you don't mind just not using the chat whilst the presenters are presenting, just so that it's not distracting for them. But please do use the Q&A function, which you'll see at the top of your screen, a little speech marks with a question mark in it. Please use that to ask any questions as we go through, and we will come to the Q&A at the end. So just to say as well that we will be using the word woman today to describe women giving birth, and we do understand that not everyone identifies in this way, and so please adapt what we're saying accordingly. And just to say that this will be recorded, the session today, and it will be available on our National Pre-Hospital Maternity Newborn Care YouTube channel following this. If you would like to share it with colleagues, that would be really helpful. The other thing to say is that we will be sending out to you all a feedback form and a certificate following the attendance today as well. So it's my pleasure to introduce Heidi Eldridge, CEO of Mama Academy, just to give us a bit of an update, an overview of Mama Academy and who we've been working with so closely on this project. So over to you, Heidi. Thank you.
Thank you. Thanks for that kind introduction. It's been an absolute pleasure to be working with you on this project. So thank you for giving us the opportunity. So yes, I am Heidi Eldridge, and I am the founder and CEO of Mama Academy, the Safer Pregnancy charity. And my journey began right back in 2009. I was pregnant with my first son, Aidan, and I got to 36 weeks pregnant when he was very sadly stillborn. It was obviously a huge shock and incredibly traumatic for everybody involved. His death was actually marked as unexplained, and I was told that it was just one of those things. However, I later found out that he was growth restricted. I hadn't been told what to look out for in my pregnancy, and so I therefore felt quite naive. 2 days just before he died, I experienced severe pain in my ribs, and I'd never been told to monitor his movements. I was also considered high risk because I had gestational diabetes, and yet his lack of growth was never picked up. So when I met other bereaved families, I realized I was not alone. The statistics at that time were absolutely shocking, and I found that so many parents, including myself, wished that we had known certain things during pregnancy. So that led me to start Mama Academy, the charity. And we empower expectant parents with safer pregnancy information, and we support you, the healthcare professionals, in your practice so you can stay up to date with the latest guidelines and research to enable you to provide the very best care possible. So Mama was founded in 2012 because the UK has one of the highest stillbirth rates in the developed world, and even today there's around 4,600 babies that die before or shortly after birth every year, which affects 13 families every single day. And many of these deaths are potentially preventable. So we support midwives through a wide range of training programs. We have webinars such as this one, collaborations with other organisations, and very close partnerships with NHS trusts and NHS England. Everything we produce is co-created with professionals like yourselves. So if you do ever identify a need, or you find that something in your practice isn't quite working as well as it should, please do get in touch, because we'd love to work with you to create something that truly helps. All of our resources are inspired by you, because we want to create something nationally that really does support expectant parents. So one of our key resources, which I'm sure a lot of you know about, is our wellbeing wallets. So the wellbeing wallets provide everyday prompts to help parents have a safer pregnancy. They include information on signs and symptoms, which means they should call their midwife, as well as guidance on monitoring their baby's movements. The wallets are full of QR codes, which link directly to information on our website. There's a dedicated page specifically for Black and brown parents, because we know that they're much higher risk of baby loss. And then we also have our pregnancy passports. So these contain much of the same information as the wallets, but they're particularly useful for trusts that have gone digital, because they no longer need the big wallets to put the handheld maternity notes inside. The passport also includes space for parents to record their essential health information. And this is vital if a parent receives care in another trust using a different digital system. It's also incredibly useful for paramedics, because they can immediately see medical history, blood type, and other important information. An audit concluded that trusts using the wallets and passports had a significant reduction in stillbirths, and a recent FOI request for 2025 stats showed that one trust had reduced their stillbirths by 37% when they implemented the passports, which is just incredible. We've also developed ambulance call cards in collaboration with the London Ambulance Service, and we've worked with SE CAMS to create one for their area too. And these cards support home birth teams by providing key prompts to help ensure a Category 1 ambulance response during urgent transfers to hospital. So on our website, we have a dedicated professional hub containing evidence-based information. There you will find latest guidelines, reports, news updates, training videos, and webinar information. And we also run awareness campaigns across social media to help raise awareness of certain conditions, signs, symptoms, all those things, to empower parents to know when they need to act. So all of our resources connect back to the website through the QR codes, which is then translatable into over 100 languages. So if you ever need information on a particular topic, such as breastfeeding, VBAC, you can just print the resources directly from the website in a language appropriate for your parents. We also host the Mama podcast, and these episodes are for parents, but there's also lots on there dedicated to maternity healthcare professionals. And you can find that on Spotify, Apple Podcasts, and wherever you listen to your podcasts. There's also a link on our social media pages. New episodes are released every 2 weeks, so I'm sure you'll find the topics very helpful and interesting. And if you'd ever like to be a guest on the Mama podcast, do just let me know. Let me just change my slide. This is the last one. So you can support us by distributing our resources within your services. We are currently distributing 300,000 wallets and passports a year, but there are still some hospitals that don't yet provide them. They cost just 75p each, and we are very happy to provide samples along with the evidence showing the incredible impact they're having on reducing stillbirths. We also deliver training sessions, talks, university lectures. So if you'd like us to come and speak to your teams within your study day, do let us know. And to keep up to date with maternity news and the new resources that we develop, you can join our mailing list, which is from our homepage on our website. And you can also follow us on all the different social media channels, depending on which one is your favourite. The work we do really does make an impact. Before we began, there were 3,811 stillbirths in England and Wales, and it then dropped for the first time in 20 years. In 2023, there were 2,230. So we're actually helping to save over 1,300 babies' lives every year. So I just want to take this opportunity to thank you guys for everything that you're doing to help prevent baby loss. Thank you so much. I'll hand back to you now, Camilla.
Thank you so much, Heidi. And yeah, it's really powerful to hear the impact that yourself and Aidan have had on this world and so many women and families. So thank you so much. So I'm now just going to present the next slides. So perhaps someone can just tell me if they can see them from the team.
Yes, yeah. We can see them.
Great, thank you. So as Heidi said, we came to Heidi and asked if we could collaborate to make a patient information leaflet for women planning birth outside of a hospital. And I think Heidi replied within about 10 seconds to say, yes, absolutely, we could collaborate in this way. So we're so grateful for this collaboration. And it's been a massive team effort, and you'll meet some of the team as we go through. So just a bit of background. So as midwives that work in the ambulance service and paramedics, specialist paramedics that support maternity and neonatal care, we really feel that the ambulance service is a key stakeholder within maternity and neonatal care provision and preventing harm and supporting women to have empowered and safe births. So what we realised through feedback from women and families, but also from maternity staff and ambulance clinicians, was that sometimes when women are choosing to give birth outside of hospital, the information that they have about how the ambulance service may support them if required was not always consistent or available. So we created this leaflet in response to that feedback to try to make sure that women and families and their healthcare professionals that are supporting them have evidence-based information to support that decision making. We want to help the maternity care professionals that are looking after these women to ensure that they have a personalised choice and have a holistic discussion about all the elements of choosing a birth outside of hospital for them. So what we feel is that this information is really important alongside the rest of the information that the women and families will be given by maternity services. So as I said, this project has been a massive collaboration across many different partners, and we're so grateful for everyone that's contributed, and I'm sure that there's many people on this call that have reviewed and contributed to this leaflet. We co-designed it with women and families, as I said, but also midwives, many maternity professionals from different specialties and ambulance clinicians. And what we wanted to make sure is that this leaflet would enable women and families and maternity professionals that are supporting home birth and outside of hospital birth to give women information about what may happen if they require an ambulance. And we're well aware that there's many home births and births in midwifery-led units that happen uneventfully every day and don't need the ambulance service. But the small proportion that do, we wanted to make sure that there's some consistent information out there for everybody. So I'm now going to hand over to Steph.
Good morning, everyone. My name is Steph Pearce. I'm the Education Manager Midwife and Patient Safety Midwife from South Central Ambulance Service. We're going to cover what is in this leaflet. So as Cam said, this leaflet's for women giving birth outside of hospital setting and their support people, as well as information for healthcare professionals supporting people planning a birth outside of hospital. So it highlights and explains the practicalities of the ambulance service in terms of how to prepare for a home birth, aspects to help with locating properties efficiently, differences between what we might need people to do if a midwife is present or midwife isn't present, and it explains in a bit more detail kind of ambulance response times and why ambulances might take different amount of times. We're going to be covering each section in a bit more detail throughout this presentation. Next slide, please, Cam. So, preparing for a home birth. On the right-hand side of this slide, you can see a tickable checklist, and this is the checklist directly from the leaflet, and it can be printed and used as a direct checklist, so that we can fully prepare families in the event of needing an ambulance at a birth outside of hospital. So this checklist covers accessibility. It includes the use of the mention of the What 3 Words app, as well as the importance of the knowledge of the postcode of the address that you're in by all the people within your location. And this will ensure that even if you're kind of in the newest housing estate that exists and the postcodes aren't on any of the kind of Google Map systems, that the ambulance service will be able to reach your location. It also covers how to help the ambulance service reach your property, so highlighting things like clearing pathways, making sure house names are visible or house numbers are easy to see. It covers practicalities like making plans for any pets you have in the house or any children that you might have in the house if you did need to transfer to hospital. And you'll also notice in that checklist that it does highlight access to the ambulance service for women and families that may be experiencing health inequalities. So, for example, it explains there how deaf people can contact the ambulance service. There are references to this throughout the leaflet, and as healthcare professionals, please feel free to use the information in this leaflet in other areas of your work, as well as home birth planning. And I will now hand over to you, Bethan.
Thanks, Steph. So throughout designing this leaflet, we recognise the importance of outlining what to expect during a 999 call, and really acknowledging that it's unlikely for any woman to include such a scenario in her birth plan. So we understand that making a 999 call in this context can be extremely vulnerable experience, and we hope that this leaflet and information will support women and their birth partners if this is ever needed. So the ambulance service should be used for emergencies and never as a substitute for regular maternity care. It is important to note that ambulances can't be scheduled ahead of time and that staff aren't able to wait outside a home or a freestanding birth centre just in case they are needed. For this reason, it's crucial that women and her birth partners know and also understand how to reach a midwife directly. As Steph just mentioned, this leaflet offers accessibility support for women with communication barriers, and thanks to Mama Academy, as Heidi said, is available in over 100 languages. It offers guidance for deaf individuals on using the 999 text service, and anyone calling 999 can request to communicate in their first language with an interpreter provided whenever possible. If an ambulance is needed before the midwife arrives, the woman should dial 999, and it's a good idea at this point to use loudspeaker functions so that instructions can be followed more easily. The person who answers the 999 call is a call handler. So it should be noted that these are not clinicians and have no medical background. They followed a structured script to quickly and safely collect important information. The questions that are asked during this point in the 999 call do not delay any help. They just ensure that the right response is sent. So as the 999 call proceeds, the call handler will ask essential questions. This could be whether the patient is breathing, asking the caller exactly what's happened and the exact location of the emergency. And that's why we have the checklist within the leaflet that Steph has just gone through. So it's really important to clearly state the reason for the call. They will ask how many weeks pregnant the woman is and any relevant medical or pregnancy history if a midwife is calling at this stage. Now, the woman is essential. It's essential that midwives use simple language for clear communication as the call handlers and not medical. So the call handler may continue asking questions and giving instructions to support care remotely until help arrives in person. Again, just reinforcing that this does not delay any response. It's part of making sure that the woman is safe from the moment a 999 call is made. These may also include practical advice such as turning the lights on and locking doors, opening the doors, and if the call ends or the situation changes, a 999 call can be made again at any time. So the ambulance service now have clinicians. These may be paramedics, nurses, midwives within our control rooms, and we just want to note here that a clinician may call a family back just to gain more information or provide further instructions in some situations. So I'm just going to hand over to Susie. And what I should have said at the beginning is, my name is Bethan, and I'm a midwife from the Welsh Ambulance Service.
Thanks so much, Bethan. Hi, everyone. My name's Susie Ryan. I'm the Maternity Quality and Governance Lead at North West Ambulance Service. I'm also the Maternity and Neonatal Representative for the Royal College of Paramedics. So we're going to be discussing how the leaflet speaks about ambulance provision. So when a 999 call is made, this is triage, and this information is provided on the leaflet to help families understand that their call might be categorized. The call category is determined by the information that the provider, the caller provides, and that helps to determine which category of the response. So the leaflet helps to explain what different call categories are and how quickly the ambulance service aims to get to the patient, depending on the information that's been provided. So for an example, a category 1 call is the highest priority call that we might get. And this is an immediate life-threatening emergency, such as the baby isn't breathing. The average response time nationally is about 7 minutes, and the ambulance service aims to get there with about 90% of the time within about 15 minutes. We also have category 2 responses, and these are also emergencies, which require rapid assessment and treatment with an average response time of about 18 minutes. And in 9 out of 10 times, the ambulance service aims to arrive by 40 minutes. So obviously there's not an ambulance waiting for each property in the whole of the UK, and response time can be affected by call volume surges, for example, during winter pressures or localized emergencies or major incidents. Geographical locations can impact this as well, and generally rural and coastal areas experience longer response times. So this might be something that you discuss with families in order to kind of prepare, particularly if they live in those more rural situations. Staffing and resources, so the number of fully staffed ambulances and emergency dispatches at any one time can impact response times, and whereas some of these aspects can be predictable, there are some aspects such as weather and cold surges which can be unpredictable and can affect some response times. So if it's particularly snowy, these are the sort of things that you might be speaking to families about, saying, look, if there's adverse weather events outside, you might have a longer response time for an ambulance. So we can obviously think about who might be turning up at the house when a 999 is made. Now, typically, an ambulance will be sent, and typically this could also be followed by a car, or the other way around, a car can arrive first or an ambulance first. So where this leaflet helps there is it helps the families to prepare for this insurgence of ambulance service response personnel who might be turning up at the house, because sometimes we send multiple resources, and this could include doctors and critical care paramedics, ambulances and cars, and a multitude of responses might turn up into the house, which can be a little bit intimidating if that's not what you're expecting to happen. So when the ambulance service are required to provide treatment and transfer to hospital, the leaflet helps to explain what a transfer to hospital is and provide some helpful information about what could impact the transfer. So the transfer is how quickly the patient can get to hospital. So the things that might impact this transfer is any treatment that's required before the patient needs to leave the house, how easy it is to get to the ambulance. If you think about those rural places, sometimes the ambulance can't park right outside the house. The distance to the hospital obviously has impact on how long it's going to take to get there, and the traffic and weather conditions on the road at the time. So icy and snowy conditions, obviously we need to go a little bit slower to be safer, and traffic, and as much as we will use lights and sirens for most of the time, it still impacts on the ability to get there as quick as we'd like. Next slide, please. So when we think about our ambulance clinicians turning up, there are different personnel on ambulance service, and they might all bring a different scope of practice. So as I mentioned before, this could be an emergency medical technician, it could be a paramedic, it could be a critical care team, or a doctor that turns up. Typically, an ambulance will have at least one paramedic, but this is not always the case. However, if one is required, then those ambulance clinicians who have turned up will call for a paramedic or any other support to help support them on that day. So the leaflet helps to explain that paramedics have a different scope of practice to midwives, and they don't carry the same kind of equipment to measure the baby's well-being. The training is also very different, and it helps to explain why paramedics or ambulance clinicians would recommend that families are transferred to hospital sooner, particularly in the absence of a midwife. So the leaflet also explains that the families can be expected to be treated with kindness and compassion. However, it's likely that the birth plan that's been put into place won't be prioritised if an ambulance has been called to assist. The ambulance service personnel may also be a mixture of male and female. It might be an all-male crew or might be an all-female crew. However, where we can facilitate family wishes, we will try to do this. The leaflet explains that where families might have specific cultural or religious wishes, that these are to be communicated with midwives antenatally. However, it's also useful for the ambulance clinicians to know as well, so they can help address these needs to maintain a patient-centred approach during the treatment to hospital. So Kerry will now discuss the aspects of the safe transfer of patients to hospital.
Good morning, everyone. So my name is Kerry Wykes. I'm a dual registered midwife and paramedic who works as a specialist clinician with the East of England Ambulance Service, and I'm also a labour ward coordinator at Peterborough City Hospital in the east of the country. So as Susie's very kindly handed over to me, the leaflet goes on to discuss hospital transfer. Now, we recognise that not all of those mums and babies that we attend will be recommended to be transferred into hospital, but certainly those where midwives aren't in attendance will be recommended for transfer. So I think it's really important that families have an oversight of what, or an insight rather, into what they can expect as part of that transfer of service. So both the baby and the woman will need to be safely secured in any ambulance, much as they would need to be in any car or any other vehicle. And it's the driver's responsibility to ensure the safety of all of those people in our vehicle. So they kind of have overarching responsibility and contribution towards how people are secured within those. Most of our ambulance services do use a specialist neonatal harness, and these attached to the ambulance stretcher. Where these are available, these will be advised to be the safest method to convey the baby. We can't convey babies in skin to skin. As previously mentioned, they both need to be safely secured within a vehicle, and particularly when we are potentially conveying on blue lights, that added level of risk is there, even more so than conveying a baby in arms, as we would see sometimes. It's really important that we optimise the safety of both mother and baby. If there is any treatment required on a stretcher for the mother as well as the baby, it's very likely that they'll be separated for their journey to hospital. We know this creates a lot of feelings for our parents and a little bit of kind of concern, but wherever possible, a birth partner or a family member can always travel with the baby, and a midwife will travel with the baby or with the mother, depending on whose clinical condition will need to be prioritised, and that will be discussed by the ambulance clinicians at the scene. But we will always endeavour as ambulance personnel and as midwives to ensure that that mum and that baby are reunited as soon as is safely possible. And that's usually on arrival at the hospital. We also felt that it's really important that people have an understanding around destination, and those in the event where an ambulance is called, so within those emergency settings, often the most appropriate maternity unit will be the nearest maternity unit, and that we recognise isn't always the booked maternity unit, but if there is any emergencies or any red flags present within the clinical presentation of either the mum or the baby, then the nearest appropriate maternity unit is going to be the one that is going to be conveyed to. So if I'm able then to talk around my next slide, if possible, Cam, and how we want to use the leaflet. So hopefully you can see there's a lot of information in here, but it's something that we think is, as we've already mentioned, really important, that there's a consistent advice to support those who are opting to birth outside of the hospital setting, but also to be utilised by our midwives, the birth support for the individual and for the families. It's available in a PDF version, which can be printed out and can be given to families, but it's also, as has been previously mentioned, it's available in 100 languages via a QR code be linked in with the families. We want this to be kind of utilised as much as possible, and it not just to be handed to the patient as part of their birth discussion, but actually to be the contents of it to be actively discussed to support their decision making and that informed consent when it comes to opting for birth outside of hospital. We also hope that wherever possible it will be available for women and families as early as wherever possible within their care journey, so that they can really absorb that information before they make their decisions as to where they would like to birth. So that will include those opting to birth without medical assistance, be that free birth, or those that are wild pregnancy and free birth as well. But it can be used by anybody. So that's, as I said, doulas, partners, families, and birthing person and the midwives to support their own information, as well as delivering that information to the individual. So I will hand over to Damon, who will discuss it further.
Thank you, Kerry. Morning, everyone. My name's Damon Wedden. I'm a sector clinical lead for the East of England Ambulance Service and also the regional maternity lead for the Trust. So I'm just going to take you through the next steps. So really around the socialisation of the leaflet, we feel that widespread socialisation of the leaflet will clearly demonstrate the advice for women planning a home birth, and that can be effectively translated from guidance into meaningful system-wide practice. It highlights a structured approach, ensuring that consistent information reaches families regardless of where or how they choose to give birth, ultimately improving safety, preparedness and confidence. Having widespread socialisation allows visibility and accessibility, and by incorporating the leaflet into the ambulance public service websites and embedding it within maternity platforms, the information will be readily available at key points of care and decision making. I just want to take this opportunity to say a massive thank you for the Mama Academy for hosting this leaflet on their website. We also feel that for women and families considering home birth, it ensures that they can easily access trusted guidance in real time. Sorry, the lights have just gone out. Trusted guidance in real time, particularly in urgent or uncertain situations, and it strengthens the continuity of messaging, reducing variation and the advice families receive. The standardisation of the information to families is another critical advantage, ensuring that all those choosing an out-of-hospital birth, including home birth, standalone birth centres, free birthing and birthing outside of guidance, are receiving the same information, which reduces inconsistencies in communication. The standardisation promotes equality in care, ensuring that every woman, regardless of their chosen birth setting, has the same access to high-quality, safety-focused information. In practice, this helps families better understand when to seek help, what to expect, and how to respond to the changing circumstances, supporting safer outcomes. The emphasis on broad social dissemination further strengthens its impact. Sharing this leaflet with the local maternity neonatal voice partnerships, Doula UK, and other community peer support networks expands its reach beyond formal healthcare environments. Now, these groups often have trusted relationships with their families and can reinforce key messaging in a relatable and supportive way. Encouraging webinar attendees and professionals to share this far and wide, it amplifies the effect, creating a ripple of awareness that can reach diverse and sometimes unserved populations. Importantly, we really want your feedback. and how it's received by service users, which is essential for continuous improvement. Gathering feedback on the leaflet contents and effectiveness allows us for refinement, ensuring that the information remains relevant, understandable, and is impactful. The evaluation process helps us measure whether the leaflet is achieving its intended outcomes. The inclusion of interdependencies strengthens the narrative by demonstrating how this initiative aligns with the national priorities and frameworks. This leaflet supports the ongoing work in the national home birth standards, ensuring the advice is grounded in recognised best practice for out-of-hospital birth. And connection to the maternity care bundle highlights its role in supporting broader safety initiatives, reducing further harm. Furthermore, integration with the national quality improvement and training groups ensures that the leaflet is not just a standalone resource, but part of a coordinated and system-wide approach in improving maternity care. So overall, we see the benefits of widespread socialisation for women planning a home birth translates to clearer guidance, better preparedness, greater confidence in navigating their birth choices safely. Thank you.
Thank you so much, Damo. What we wanted to do just briefly now at the end of the webinar, before we come to the question and answer session, is just to highlight the guidance that's used by ambulance crews in case people weren't aware. So JR Calc is the guidance that is used by ambulance clinicians across the UK, and it stands for Joint Royal College's Ambulance Liaison Committee. And they essentially host the guidelines that are used. And we have a whole section of maternity and neonatal guidance that we have been updating steadily over the last 3 years, updating or creating new guidance. And if ambulance clinicians are on scene, as mentioned previously in the webinar, ambulance clinicians will be expected to use their guidance, and that will be different to the guidance that midwives are using. One particular guidance that we wanted to highlight was the pre-hospital maternity decision tool, which is in operation across the 4 nations of the UK in every ambulance service. And this decision tool is to aid ambulance clinicians to understand if a woman who is perinatal, so throughout pregnancy and postnatal up to 4 weeks, has any red flags. And the parameters that are within this decision tool come from the maternity early warning score parameters, the national maternity early warning score parameters, which are being rolled out across the UK in maternity services. So it's just to say that if midwives, if you're on scene with an ambulance clinician, they will be using these parameters, but these parameters will be coming in for all midwives across all services anyway. And they will be using these in kind of a more binary way because we are in the pre-hospital setting and we can't exclude serious illness. So when a woman has any red flags, according to the decision tool, if midwives are not present, that would initiate a time-critical conveyance to a maternity unit for immediate assessment and intervention. And if midwives are present, then this would be something that we would expect the ambulance clinicians to discuss with midwives and make a joint approach plan with the woman and her family as well. We just wanted to highlight as well that this is in the element 2 of the National Maternal Care Bundle, so you can see more information around this pre-hospital decision tool and the implementation and the digitisation of this tool, but also you can see the other interdependencies that Damo talked about earlier in terms of pre-hospital care. So that brings us to the end of the presentation element of the webinar. What we wanted to do is just thank Mama Academy, Heidi and Aidan again for facilitating maternity and neonatal services to do such quality improvement projects like this one, and for all your support in publishing this leaflet. And we'd also like to thank all the women and families and all of the stakeholders that have been involved in creating this leaflet and providing feedback and reviewing it. In summary, we really feel that as the ambulance service, we support midwives to support women, and therefore we are absolute key stakeholders, and we want to be involved in anything that involves maternity and neonatal care where the ambulance service can support. And we feel that it's really important that women and families across the UK are supported to have home birth as an option, as well as midwifery-led units where relevant. And this leaflet is a way of us doing that, of us supporting those birth choices to be available to women and families. So as you can see here, the leaflet is available via this QR code. It's also available on the Mama Academy website, which Heidi's kindly posted in the chat. There's also the link to the national YouTube channel that I mentioned in the chat where this recording will be hosted. And also in the Q&A, I have posted the link to the Padlet, which takes you to the key person within your region for pre-hospital maternity and neonatal care. So thank you so much to all the presenters. And what we will do now is come to the Q&A. But before we do that, just to mention as well about feedback for this particular webinar, we will, as I said at the beginning, send a link to a feedback form, which we'd really appreciate if you could take a couple of minutes to fill out. And also we will send a certificate to you for your attendance today. So what I will do is just stop sharing and come to the questions. And I've got the panel ready to answer the questions. So the first question I have here, I'm going to come to you, Kerry, if that's all right. Leanne says, we often transfer baby skin to skin with mother. Do you advocate for this? So if you can just...
Of course. So unfortunately not. And I know that as midwives, that hurts our heart a little bit. As a midwife, it hurts my heart a little bit as well. But unfortunately, for the safety of mum and baby, we don't recommend that they are conveyed in skin to skin or in arms. As I mentioned very briefly on the slide, particularly if we are travelling in blue light conditions, it has additional risks, and as much as we do our best to mitigate those, we would hate for harm to come to the baby or the mum. Also, it is actually written in the Road Traffic Act. So how many times I've answered this question in the 2008 addendum to the Road Traffic Act that says that where a neonatal harness or neonatal car seat, for example, is available, that should be utilised. And as our responsibility as ambulance services is to ensure that all of our patients are appropriately secured in the back. We can always point people towards the Safe in the Back campaign, which was held by the Ambulance Association of Chief Executives. The videos are quite traumatic watching, but they are very, very powerful to demonstrate the importance of securing all of our patients and actually our staff members as well, wherever possible in the ambulance. So no, we don't advocate skin to skin or in arms transfers.
Thank you so much, Kerry, for that answer. Steph, can I come to you with this one? So will these leaflets be distributed to ambulance services for us to hand out to perinatal patients, i.e. if we visit them for abdo pain?
So we're not going to be kind of printing them and keeping a copy of them on the ambulance service. I can only speak for my own as South Central, but what we can all do as ambulance services is signpost all of our staff to the website that it's on, and then on whatever kind of EPR system you have, you can absolutely show your patient or get your patient to access it on their own device so that you can look at the leaflet with them and explain the information that you're saying to them with the kind of illustrated leaflet that we've just talked about throughout the day. So not a paper copy, but the electronic version will be out there, and within all the trust, I'm sure we will send out to our staff so that everyone can access it.
Thanks so much, Steph. Susie, I'm going to come to you. The question is, why can car seats no longer be advised for well babies to avoid unnecessary separation? NWAS have recently advised that mothers and babies must be separated regardless of clinical picture.
NWAS haven't said that mothers and babies must be separated, but what we have said is that every patient needs to be sufficiently harnessed, and I believe that's a national picture across the 4 nations that we've mentioned. Car seats are problematic where paramedics or ambulance clinicians are using them because, first of all, not all of our ambulances are the same. So securing car seats aren't the same in every ambulance. Also, baby sizes are all very different. So we might have a premature baby that's been born, and put in the car seat is not a safe method for our babies to be transported in that way. It's also another way that we can keep babies warm, transported in the hospital in a car seat. So with the harnesses, we're able to use our warming devices, such as the warming mattresses and any other blizzard blankets or anything that we need as well. We can kind of supplement the thermoregulation and have a safe transfer by utilizing our newborn harnesses. Mothers and babies, sometimes we do need to separate them in ambulances because obviously our postnatal women in pre-hospital are already high risk by virtue of the fact that they've sometimes given birth without the assistance of a midwife. So they're already high risk and potentially might need the stretcher themselves. So where we have a mother requiring a stretcher and a baby requiring a stretcher, we would like an ambulance each. But you have to think about we now have 2 patients, and what we would really like is a paramedic and monitoring per patient if possible, which we would typically expect. And I think the difficult conversation can be kind of really easily established by by having the conversation that you're going to be bringing the mother and baby together as soon as possible. I think any explanation to the families where we're speaking about safe transfer of parents and babies, I think there's plenty of rationale there, especially when we are suggesting, like Kerry has before, that a family member or somebody can go along with the baby as well, so the baby's not by themselves, if that's something that we can facilitate.
Thanks so much, Susie. And just to say, you don't need to put all your emails in the chat, even if you're in a room with lots of people. We will liaise with you following this. So don't feel you need to put your emails there. So just Damo, can I come to you on this one? So the comment is, thanks so much. This leaflet is incredibly helpful. So thank you for that feedback, Sally Ann. As a doula, I am finding that many midwives call for an ambulance when they are unable to attend without telling parents or asking for consent. This means that on occasion I've been in a difficult position where the ambulance crew would decline entry to the property. In both cases, either the police or social services were called. What do you recommend a doula to do in this very uncomfortable and difficult position when the parents do not want a crew to attend their birth?
Yeah, that's a really good question, and we do see this across our trust and other trusts as well. I think what we would say is that if an ambulance is being called, we're being called on in an emergency situation, and albeit that the fact is that it might not have come from the person on scene, and it might have come from the midwife. We do have a duty of care once we get there. So I think having those clear lines of communication is absolutely key when we get there, and understanding what is required from our service or the ambulance service, but also in terms of the midwives calling an ambulance, again, I would imagine there was a point of escalation. That's why a midwife has called for an ambulance. So I think it's just about really having those clear lines of communication. But certainly when our crews get there, we certainly want to have a conversation with yourselves to understand why we've been called and whether there's any help that we need to give in an emergency situation.
Thanks so much, Damo. Heidi, can I come to you with a question? How much are the passports in comparison to the Mama Academy wallets, please?
They're exactly the same. Actually, we've kept the price the same. So they're
Awesome. Thank you very much. And maybe we can answer this together, Heidi, just around the update, if the governance process for updates, if we are wanting to change the leaflet at all. So essentially the one that is on that's live on the Mama Academy website at any one time, that is the most up-to-date version. So that's the one that we'd want you to use with women and families. And if we do update it, we'll send out communications to that effect. Heidi, do you want to come in on anything to do with that?
Yeah, so we always review our resources annually anyway, no matter what it is, whatever organisation. But we can do that instantly. So whether there's a PDF or a web page, we can do it instantly. And then it just means everything's done in real time. So that's why the language can be updated as soon as we update the English version. All the languages will automatically be updated. So yeah, it can happen instantly. It doesn't take very long.
Brilliant. Thank you so much. And Bethan, I have a question for you, if that's okay, if your voice is still going. So when managing a cord prolapse, do you support the mothers to transfer in the all fours position to enable the midwife to continue displacing the presenting part?
So, and unfortunately not, going back to Kerry's point and safely transferring in the back of the ambulance, JR Calc guidance will support raising the woman's pelvis to alleviate the pressure onto the cord to safely transfer. And it's worth checking how you work with the midwives in your areas. I know for us in Wales, we talk about in our obstetric emergency training in the community, just fill in the bladder for transfer if that's not going to impede any time before going to transfer. But back to Kerry's point and all the legislation that Kerry has just explained, we have to ensure that the 5-point harness is strapped on mum to make sure that she is safe in the back. And just to reinforce that, as UK Leads Group, we often discuss incidents that have happened and any learning, and we do see positive cases coming out of cord prolapse and being transported this way.
Thank you very much. There's a question here around the NLS algorithm, and so I'm going to take the question, and then if anyone wants to add anything, please do. So the JL Calc algorithm for newborn life support has been particularly adapted, or specifically adapted for ambulance clinicians with the knowledge and training and resources that they have available to them. So that's why we are advocating for the ambulance clinicians to use the JL Calc newborn life support algorithm. And oxygen is either on or off in the pre-hospital setting. So that's why we have advocated for the 15 litres into the BVM to provide 100% oxygen from the beginning if the baby is under 32 weeks, and if at term we would provide it from the point of chest compressions. And Bethan, just a follow-up question on that. Somebody's just asking whether you're going to use the same JL Calc algorithm in Wales.
Yeah, JR Calc is guidance for ambulance services throughout the UK, so we're very lucky that that's standardised throughout the UK, so the Welsh Ambulance Service staff will be following the same guidance. Thanks
very much. And Terry, can I just ask you this one? So if in the event of a PPH, a community midwife commences bimanual compression, how will they be able to continue this whilst ensuring everyone is strapped in?
I think you said Kerry. Yeah, so bimanual compression obviously is incredibly difficult, and I think we've done a few run-throughs of this. It does vary slightly, but certainly run-throughs that we've done in the east of England, conveying a midwife and a patient whilst doing bimanual compression is incredibly difficult, and actually presents additional dangers. For example, going over road bumps and things like that with a your fist in the vagina at the time. So what we generally advocate is that bimanual compression is done for up to 10 minutes on scene as per the JRCALC guidance, and then stopped and returned to uterine massage. Then as we look to convey the individual, which can be done much more safely, with somebody secured in a seat that's parallel to the stretcher, and able to provide that at the time.
Thank you very much. And there's a question asking if the ambulance service workforce is represented in the National Home Birth Steering Group from NHS England. Susie, do you want to come on that?
Yes, that's a short question. That's a short answer. Yes, we've got the representation from the Royal College of Paramedics will be on the steering group for the National Home Birth Standards. Yeah. We also have in the working groups as well, there's representation across the Ambulance Service Trust who are in the working groups writing those standards. So it's the pre-hospital is well represented across, yeah.
Lovely. Thank you very much. And I think in the interest of time, I'm going to make this the final question. Are the harnesses in use UK-wide? And this particular person saying, I've never seen them in use in Northern Ireland. So Damo, do you want to answer that?
Yeah, so the harnesses are there for safe transport, and if an ambulance service has a harness, by law they should be using those harnesses. We shouldn't be advocating skin to skin. It is very dangerous for all of the reasons that we've mentioned. If mum collapses, what do you do with baby? If baby collapses, what do you do with mum if you're just on one stretcher? And I always equate it, it's very similar to putting mum in the front seat of a car, putting a seatbelt on and asking her to hold her baby. You would never do that. So, and that's effectively what's happening. You're asking the ambulance service to do that. So if the harnesses are there, the harnesses are absolutely there for safe transportation, in use with some thermoregulation, as well as Susie mentioned, our transwarmers and our insulating wraps. I can't speak specifically for Northern Ireland, but if they have harnesses, they should be utilising those harnesses for that safe transportation.
Thank you so much. We've come to the end of the webinar. Thank you so much for all the engagement and the questions. I think they've been really helpful questions, and thank you to the panel for answering them so comprehensively. And just another final thank you to Heidi and Aidan for impacting this work so much. So thank you to everyone, and have a great rest of your day.